Good evening, everyone. We're going to get started. On behalf of Kenneth Young Center, we present to you the first parent support group by the District 62 Community Navigators. Your presenters today are myself. I'm Dulce. I'm a community navigator, and Ty, if you want to present yourself.
Yeah, and then hi everyone. My name is Ty, and I am the lead community navigator for the team. And then I just wanted to state that we are very excited to be here to educate and support our D62 parents. And with that being said, I will go ahead and pass things along back to Dulce to start off the presentation.
To start off, a little bit about Kenneth Young. Kenneth Young Center is a nonprofit comprehensive provider of mental health and older adult support services through counseling for adults, children, and families. Assessment, stabilization, linkage for adults, children is psychiatric crisis. Treatment, support, and recovery service for those with serious mental illnesses, and service coordination and in-home services for frail elderly persons. And we also provide volunteer opportunities. We have provided the link underneath if you would like a little bit more information. This presentation will be about coping skills for children and parents. So to begin with, what is coping? Coping commonly refers to an individual's effort to regulate emotions, cognitions, physiology, behavior, and situations in reaction to stressful events or challenging circumstances. In other words, coping can be described as anything that one does in an attempt to manage stress. During stressful situations, coping skills can help to diffuse or turn down the volume of intense emotion, allowing for increased control over how an individual chooses to respond to the situation. Stress is normal. Children, adolescents, parents, and caregivers face a multitude of acute and chronic life stressors, and this is normal. These stressors may include pressures related to academics, peer relationships, social media, life transitions, political climate, separation of loss of caregivers, poverty, family conflict, and exposure to violence and physical illness. Physiological effects from stress. Feelings of fear, anger, sadness, worry, numbness, or frustration, changes in appetite, energy, desires, and interests, difficulty concentrating and making decisions, difficulty sleeping or nightmares, physical reactions such as headaches, body pain, stomach problems, and skin rashes, worsening of chronic health problems, worsening of mental health conditions, and increased use of alcohol, tobacco, and other substances. So healthy coping mechanisms. Number one, acknowledge your stress. Acknowledging your stress can really help lift the weight off your shoulders and could be the first step to asking for help. Facing stress is an opportunity to reset your mind and take it as a chance to grow. The brain is rewiring and trying to learn from the experience so you can handle it differently next time.
And then to continue for healthy coping mechanisms, we have cultivating a social group. Just because studies have shown that by simply talking about your problems and sharing our negative emotions with someone that we trust can be profoundly healing. It reduces stress, it strengthens our immune system, and reduces physical and emotional distress that we have. And then the third healthy coping mechanism would be mindfulness. And mindfulness is just a type of meditation in which you want to focus on being intensely aware of what you're sensing in a given moment, and then also what you're feeling in that moment, without interruption or judgment. Practicing mindfulness involves breathing methods, guided imagery, and other practices to relax the body and mind to help reduce stress. In fact, according to the Mayo Clinic, mindfulness can help reduce the following: stress, anxiety, pain, depression, insomnia, and hypertension. And then some examples of mindfulness would be meditation, It's always important to get the proper hours of sleep every single night on a consistent basis. And for children, this would ideally probably be closer to 8 hours per night, whereas adults can probably get away with 5 to 6 hours. And then in addition to that, we also encourage like personal care, such as hygiene. And then something to be mindful of is also healthy eating habits. In addition, we want to potentially like exercise. And once again, that doesn't have to be anything strenuous. It honestly is based off of the individual and what the individual can do. For example, maybe go outside and take a 10-minute walk, 15-minute walk, whatever you can handle. And then lastly, we have listening to music, just because music can speak to us in multiple volumes. So that can also be another tactic for relaxation. And then based off of the previous slide, off of examples, we want to stress the importance of routines. So according to Mental Health First Aid USA, having a routine can make you feel more grounded and prepared for the day ahead. Routine activities reduce stress by making a situation appear more controllable and predictable. As there is a reduction in stress, your routine can benefit you mentally and physically. Eating habits, exercise patterns, sleep schedules can impact how you feel and function on a day-to-day basis. And then since we're dealing with COVID-19, routines have become more important now than they ever have before. Since we had the stay-at-home mandate, working from home for the first time with family and children with us has definitely presented new challenges. And due to these environmental factors and schedule changes, these are additional stressors that can add to our day-to-day lives. Okay, and then if you are feeling stressed in any given moment, we highly recommend this fun little mnemonic device, and it's called STOP. S stands for stop, and what you want to do is you just want to take a momentary pause, whatever you're doing. And then T stands for take a breath. So here you want to reconnect with your breath, and the breath is an anchor in that present moment for getting you to your calm space. And then O is observe. So you want to notice what is happening. So what is happening mentally and physically, and then where your mind has gone, and then how you feel in relation to that, and then what your next steps are that you're going to do. And then P is for proceed. So here you want to continue doing what you were previously doing or not. Just use the personal check-in to change your course of action. And whatever you do, you just have to do it mindfully. And then 4, we highly recommend, if some of these techniques are not working, it's important to know when to seek additional help, such as therapy. When stress levels are consistent, when stress leads to consistent negative behaviors or otherwise negatively affecting our well-being, meeting with a mental health professional or medical doctor can help. Health professionals can work with you to treat your stress symptoms and work through the issues that are causing it. Therapy can help address stress that occurs as a result of life events. And when a person is stressed, therapy can help address these concerns and other effects they can have on a person's life. And this can also reduce stress for everyone involved, such as children, parents, and peers. And then here is a list of the resources that we had pulled all the information from. So if anyone wants to do further research, we highly recommend it. And then here is the list that you can just go ahead and click on, and it'll bring you directly to the educational website.